Hello and good Wednesday afternoon. This is Victoria Hill, the Public Information Officer for the City of Billings on this 18th day of October 2023, a day that we've had marked on our calendars for the past few months. Today's the day that ballots are sent out from the Yellowstone County Election Office. All Billings residents registered to vote in an absentee election will receive their ballot maybe tomorrow or sometime later this week. And one of the things you'll see listed on there, the $143 million bond for parks, recreation, and trails. So today we are going to focus our topic on public health. We've already been through public safety. We've spoken about the cost of this bond and some other things. So we just want to get all the information out there to the folks. So when you do receive your ballot, you can make an informed decision and you decide what you think is next for Billings and what is best for Billings. So we do have two guests with us today. We have Melissa Henderson with us, and then we also have Eric Owen with us as well. And Melissa, I'm going to pop the camera back over to you. Go ahead and introduce yourself and tell us what you do.
Sure. So my name's Melissa Henderson. Thanks for having me here. I'm the director of the health promotion team at Riverstone Health within our health department.
Excellent. And Eric.
Hi, I'm Eric, and I'm the Vice President of Public Health and Clinical Services at Riverstone Health.
All right. So you both probably know a thing or two about public health. Is that right?
A little bit.
Yeah. All right. Well, the first question I have for you out of the gate here, it's a loaded question. How does public health relate to parks, recreation, and trails? And Eric, I'll let you take this one.
Yeah, Melissa, chime in. I think to answer that question, we have to think about and talk a little bit about what is public health. So when we're talking about public health, we're not only talking about individuals' physical health, but we're looking at the overall well-being of our community from multiple factors. So there is physical health, and that's a big part of our health. But there's also emotional well-being. There's the ability to have access to safe spaces to live, work, and play in. There's the environmental health. All of those influence our ability to become and stay healthy. So when we started looking at how do parks and public health relate, we did some research, and we actually found a lot of stuff out there, a lot of data, a lot of research has been done that really intrinsically links parks with improved overall health of communities.
All right. And I know it is always great whether you're using the park to play a game of basketball or going out to clear your mind and get some fresh air, the
For
parks
sure.
are there for you. So Eric mentioned some data, and Riverstone Health also keeps track of some data locally. So these aren't just national numbers that we're going to talk about here. But Melissa, what can you tell us about some of the data that was discovered through the Community Health Needs Assessment?
Yeah, so we partner with Billings Clinic and St. Vincent Healthcare every 3 years to do a comprehensive needs assessment for the community. And I like to think of it as a wellness check for Yellowstone County. So just like we all go to our provider to know our numbers, know what we need to work on, we try to monitor that for the county. We try to add questions in every time that are relevant to emerging issues as well as track trends over time. And so when we completed the last needs assessment, it was sort of as the pandemic was waning. So our data came out in early 2023. And what we saw is really just 1 in 3 of our area residents are getting the recommended physical activity that we know we need to maintain a healthy physical and mental sense of well-being. We know that 1 in 2 are getting way too much screen time. We're supposed to cap ourselves at 2 hours. It's so hard to do. And what we found is that our seniors are really indulging in screen time. When you're sitting in front of a screen, you're not doing things like connecting socially with others. You're not being active. You're not kind of engaging in our civic life. So that's part of the reason that's a problem. We also know that unfortunately our suicide rate in our county is twice the national average. And that's really, really climbing. And so that's something that we feel a sense of urgency behind and really want to look up and see, okay, what can we do in the short term, but what can we also do in the long term that's addressing some of the root causes of these issues? One other thing I would just note is that it's people want to be active, people want to be a part of the community, but there are other barriers coming into play. And so we do look at disparities, we do look at what else is going on within our community. And as Eric said, you know, parks, trails, recreation, it all ties back into that physical and mental well-being.
I'm going to pull up a screen for anyone who happens to be watching. It's on our website, of course, billingsmt.gov/parksbond 2023. If you go down the left-hand menu, you'll see Parks and Public Health. So if you click on that, you will be taken to this page, and Riverstone Health had their semi-annual report come out last month, and if you would like to read the full report, you can click on that. So we just had a small peek or preview of the report up on your screen a couple minutes ago. But if you are looking for some deeper information, you can click on that. Let it load, of course. It's going to take a minute for me here, and then you can read through all the details there. All right, here we go. Finally, we're watching the line slowly crawl across the screen. So, all right, so there we have it. So, and you also have your contact information there. So if folks want to contact you and have a specific question, they can certainly do that as well. In learning about the connection between Parks Rec and public health, I also came across a term that I wasn't familiar with. And Eric, if you wanted to jump in and explain what is pro-social opportunity? What's that?
Sure. So, generally speaking, we know that people are hardwired to be social beings. They want to be around other people. So, when you're looking at things like how we build out our city, when we're talking about pro-social, we're talking about building our city and our structures and our parks in ways where it promotes connectivity between people. And, there's also a link between that pro-social aspect and activating our public spaces and pride in those spaces going up. And then when pride in those spaces go up, we start to also see the kind of impacts on reductions in public safety issues. So they're all kind of really tightly linked with each other. Do you want to add anything, Melissa?
Yeah, I think, not to get too jargony, but as we do talk about public safety within our community and we say, okay, what can we do? How do we respond? One of the things that really struck me when I moved to Billings was how everyone was like, people are involved here. People volunteer here. If they see litter, they're gonna pick it up, right? We care about one another. And so when we think about our parks as neighborhood living rooms, or we think about a rec center as a place that people can just go and be and recreate, it doesn't always have to be physically active. Those create opportunities for us to meet each other, meet people outside of our realm, intergenerational relationship building. You don't have to suddenly start driving your elderly neighbor to all their appointments, right? You can just kind of say hi at the gym when you see them. Those are the type of things that I think, Eric, you coined the term and I love it. They create the bubble wrap in our community so that when adversity hits, when issues arise in the household or in the neighborhood, we can really lean on each other and support each other. And so that's kind of that connectivity piece of let's create social spaces that support that. And again, it's not just the infrastructure at a park, it's also having recreational spaces and opportunities where kids can do things like gaming and these community centers that are included. That those can be art classes too. We can connect on a lot of different issues.
For sure. The park itself is one thing, but the programming that it enables is what really takes it to the point of being able to create that social cohesion and connectedness. Yeah.
Yeah. And when you guys were just now talking about the the spaces to become social. I just picture kids on a playground and how easily they make friends. And
Yeah.
I think we can all learn a lesson from the kids, and maybe talk to their parent who's also sitting there at the playground.
Totally.
As adults, I
Yeah.
think we tend to put our blinders on and we're like, okay, my kid's over there, and
Yeah, my
I'm gonna
toddler has
mind my own.
definitely made me more of an extrovert. Yeah.
Exactly.
Yeah. I've gotten into conversation a time or two also with a mom at the playground, and it is nice, once you open up and you
Yeah.
find what you have in common. So that's a good point, guys. Next, I want to move to the focus on our senior population. A lot of people think of parks, recreation programs as a thing for youth and children, or active individuals, but really. This is for everyone. I'm going to pull up a map there. I think people have seen this tons of times, but of the bond, there's 16 different project locations. Our goal was to get something out there for everyone, every neighborhood in Billings, and so this is also designed with our senior population in mind. So. Either one of you, whoever wants to jump on this, what can you tell us about the impact that this could have on our senior population?
You want to go for it,
Well,
Melissa?
I can start and
All
you
right,
can.
I'll hop in.
Yeah. So, I mean, I've had the privilege in the 10 years I've worked at Riverstone Health to kind of learn more about the senior population and find ways that we can work together to support. And I think Billings as a whole, we really care about our seniors. We value aging in place. The pickleball tennis community is fired up. Um, when I think about our seniors, though, I wonder how can we support them year round? And so I think for me, that's where the rec center really aligns with the public health data
Yeah.
because it's an indoor space that they can go, they can count on to socialize or be active if they like. I'm also an asthmatic, and so I can kind of relate to when it's extremely cold, really a lot of us seniors having some respiratory challenges, we really shouldn't be out there recreating, right? And so we're just going to stop 6 months out of the year in Billings. And so I think for seniors, we do need to invest in not just the idea of supporting their activity, but then the infrastructure to make it happen.
Right. Yeah. And, I think just to add to that in terms of safe spaces to recreate, a lot of our city still isn't quite to the point yet where it's safe to walk along the street if you have any kind of mobility limitations. And so creating those spaces where, there's flat level places where people can go and have that walking track around the indoor rec center just will help promote getting out and getting that physical activity.
Yeah, definitely.
All right. Well, I want to thank both of you for joining us here today. I'm going to put you on the spot. Anything else that you want to say or mention that we didn't get out there that you think people might find important or interesting at all? You don't have to. It's always my finisher.
No.
No?
I mean, I think that it's really great for public health to just be at the table to share the information behind the issue. As you said, we want people to just make informed decisions. I'm excited to look at the ballot this evening, but in no way are we, saying you need to vote one way or another. Just wanting to make sure that people see the robust data out there.
Yeah.
And yeah.
Yeah. I think the only thing I'll add is I know that, public safety issues are on front of mind for a lot of people right now. And I think, I invite people to go out there and take a look. One of the things that actually surprised me when we started looking at it is the impact that greening up your community has on public safety as well as public health. And there's no one silver bullet that's going to solve our public safety and public health issues. It
Right.
takes that mix and continuum of things
Yeah.
to address it from multiple angles. So,
Yeah. All right. Well, thank you guys. That's a great point that both of you just made. Like they said, ballots are going out, maybe even popping up in your mailbox by this evening, but they are due by November 7th. So what are we, like 3 weeks away? Review all the information that's out there. You can go to billingsmt.gov/parksbond 2023 to see what we have out there for folks to consume, take in, and learn a little bit about. And if you have any questions, that question question form is on there, so feel free to reach out to us. We'll get someone with Parks and Rec or with city administration to answer your questions. And we will see you later this week. Our next guests, we have Mike Pigg and Corey Thompson on Friday, so they'll be joining us to, I guess, wrap it all up. They are the Parks and Rec guys, so they'll be able to put everything in a bundle for us and get us filled in on how things are going. All right, we will see you then. Thank you for watching and listening.